Hi, everyone, and welcome to the show. The past few weeks, we've had rain out here in California, and now we're living up to our name, sunny California. So the sun's out. It's going to be a great day. We have a great show ahead. We have a wonderful guest, Steph Vukovich, who is going to be talking about genetics and nutrition. But she also has a very personal story that led her to our organization, our 501(c)(3, The Way to My Heart. And she joined our group, and she has been lending her expertise about nutrition to many members of our group with questions. So I thought, you know what? Let's invite her to come on and answer all of the questions at once, because she's proven to be very, very popular with all of her information on supplements and more. So I'm really excited about the conversation ahead. But hello, John.
Hello, Miss Kim. How are you?
We don't have a team in the Super Bowl. So what are we going to
I,
do?
I
I have
know.
the
Well,
49ers. Just kidding.
yes, you do.
I was
And
waiting for you to come back and say, wait a minute. I was just trying to make you feel good.
I'm trying to figure out who I'm going to pull for. And there's a lot of women in my household that I suspect they'll be pulling for the Chiefs. I myself and my son will be pulling for the 49ers, I believe.
I think Brock Purdy, he has the potential to become the modern day Joe Namath. And I remember, that Super Bowl where I wasn't alive, but I was a sports anchor, right? And I just remember that story, here's that guy that, when all odds were against him, he was able to lead his team to victory. And so if Brock Purdy can do that, I will literally tip my hat to him as being the modern day Joe Namath, because I think everyone is in favor of Taylor Swift getting proposed to after the Super Bowl trophy is handed over to Kelsey.
Um, I have no comment on that, nor does anyone care to hear what my comment is, particularly my family members. But a couple of things. I'm really excited to have this conversation with Steph because I myself and another partner, we're opening up a men's health clinic. It's a franchise that actually started in Carlsbad, California, and we offer vitamin injections. So I want to pick her brain about some of the things we offer and see if it makes sense. But before we do that, so Kim, do you think you could kind of reach back into the recesses of your mind, put your reporter hat on, and just give me one question that you would ask either Super Bowl coach, so Andy Reid or what's the other guy's name? I'm blanking. Anyway, like before they're going to halftime, like what would you ask Andy Reid? Like it's halftime. Let's say they're up 10-7. What are you gonna ask him? You're pulling him off. He wants to get into the locker room. You got one question. What are you gonna
So is
ask him?
he ahead? And I would ask,
He's
how
ahead.
do you
He's
keep the
ahead.
momentum? How do you keep the momentum going? And that's always the big question, because it's such a mental game at that point, right? Whether they're winning, they're losing. But if they're winning, they've got to keep that momentum going, because they have to be prepared for a big strategy shift, from the other team. And so obviously, in order to maintain that lead, they've got to keep that momentum. So what is their strategy, going into the second half? That's honestly, what I would
That's
ask.
I close my eyes, I could be there. Now, Kyle Shanahan, who I think is the coach of the 49ers, let's say he's down 7 points going into
Oh, wow.
halftime. What are you going to tell him or ask him, I should say?
It's such an easy thing. You honestly just want to know how they're going to, personally, I would want to know what went wrong, because they all sit there for hours and hours and hours and watch, the game footage over and over and over again. And they like, what surprised them in the first half from the other team, because they had to have been, if they were prepared, they watched the footage from before, they had to have known the team strategy. You would think that they would. So what
Mhm.
surprised them about the team strategy that left them, falling short?
Awesome. I love it. Good
Um,
job.
but I do have a little Super Bowl tie-in
Mm.
to peripheral artery disease. We talk a lot about peripheral artery disease, poor circulation in mainly the legs. And I did a little research, because I love just data. Did you know that if every 20 seconds someone loses a limb somewhere in the world due to a diabetic ulcer, as you know, many of those diabetic ulcers stem from not only too much sugar, right, in the blood, but also along with that is poor circulation. So how many, based on every 20 seconds around the world, someone is losing a limb due to a diabetic ulcer? How many do you think are losing a limb during the 4 hours of the Super Bowl? 720 people stand to lose their limbs during the 4 hours that we are sitting there watching the Super Bowl. And
Yeah.
that's really sad.
That is when you put it into perspective.
Sobering thought.
Yep. Yep.
Sorry, I'm raining on everyone's parade. I'm like the Debbie Downer. Go enjoy
Um,
the Super Bowl now.
Yes, but you know what? We're going to have a great conversation, and I think at the end of the day, we're going to learn something about. It is Heart Month, right? February's Heart Month. I just read too that Carl Weathers, who I loved in Happy Gilmore and Rocky, he died from probably an MI, but they're calling it atherosclerotic coronary artery disease. So he
Oh,
probably had
wow.
an MI. So again, the we can talk about diet because I think there's a lot of ways that people can change their diet and reduce their risk of cardiovascular events and peripheral arterial disease and
Yep.
supplements as well. So it's going to be, I think, hopefully very educational, not only for us but for our listeners.
And I think it could have a great impact. Nutrition is such a great component, as we mentioned, when it comes to diabetes, then ultimately that poor circulation. And so there is so much power that every single human being has in being able to have their fate kind of in their own hands. There's something that they
Ooh.
potentially could do when it comes to diet and nutrition in many parts of the world. Now, granted, we do have to take into consideration as we go forward in this conversation that there are a lot of people that may not have as much of a choice because there are still so many people in poverty, and the socioeconomics play such a great role in terms of cardiovascular and vascular diseases. And that's something that we all need to come together as a community and communities around the world to help make sure that the haves are able to help the have nots rise up and be able to get the proper nutrition that they need, which should be, a right for everybody to have that nutrition.
100%. You have to have faith, which is probably a pretty good segue into my quote for the day.
Yes.
Dr. John Phillips' spectacular vascular moment of inspiration.
So I know we only have about a minute left, but the book that I'm reading right now is called Think and Grow Rich. And it's not necessarily about trying to make money, but it's getting yourself in the right mindset to succeed at something that you really want to succeed at. And part of it is having faith in what you can do. And they use a term called autosuggestion, where if you think about something long enough, it can actually turn into a physical kind of attribute or actually have a physical part in the universe. It's actually really fascinating. The book was written back in the
Manifesting.
1930s. Yeah, manifesting. It's awesome. But so there's a chapter on faith, and the author is Napoleon Hill, so I'm quoting him, and he says, "Faith is the eternal elixir which gives life, power, and action to the impulse of thought." So you have a thought, you have faith in that, and then you can actualize it. So let's do it today. I love it.
I love it. Well, I have faith this is going to be a great show. We have Steph Vukovich. She's going to be here in just a few moments. We're going to head to break and we will be right back with an amazing conversation about genetics and nutrition. So stay with us. Hi, everyone, and welcome back to the show. We have a special guest today. We have Steph Vukovich. She is a specialist in genetics and nutrition and the intersection of that. And we are going to get to her in just a moment. But I do want to offer a very important reminder that you really need to make sure not to act on any information provided during this show by Steph, by John, by myself, by anyone without explicit consent from your own healthcare team. We don't have access to your medical history. We don't know your comorbidities. We don't know your current medical situation and how your body may react to supplements or foods or medicines or anything else. So please make sure you do have explicit consent from your own healthcare team before acting on any information provided here. That being said, I want to welcome Steph to the show, and I want to share how she came into my life, which was through our group for peripheral artery disease, which is that poor circulation in mainly the legs. She thought she had it. She came into our group, and even though she doesn't have it, she never left. And I'm so excited because now we have her as our expert in genetics and nutrition and the intersection of. So, Steph, thank you so much for joining us. We can't hear you. So, basically, I know that she has something that's with her veins. I'm hoping that maybe we can get her. We might have to deal with a little bit of an echo. Now we can hear you.
All right. So
Thank you so much. Yeah. So you had a
Welcome,
little
Steph.
bit of a personal story that led you to us.
yeah, so I mean, I come from a history with, my family going back, a lot of cardiovascular disease, uh varicose veins, a lot of cardiovascular issues. So when my legs started pooling after my pregnancy, it was like it happened right at the end of my pregnancy. It kind of was like I was 9 months pregnant and the pregnancy never ended after I had my son. Um, I had claudication in my legs, which is like a swelling, breathlessness, fatigue, constant pelvic pain. This one was really interesting. As I was chasing these symptoms, I ended up at an endocrinologist.
Hmm.
I told him, I said, could this be some type of like endocrine hypertension? Because I developed spontaneous high blood pressure that I'd never had before. He tested my aldosterone and renin levels. Both
And what are
were
those?
very, I'm sorry.
What are those?
Aldosterone and renin levels are hormones from the adrenals and the kidney that basically kind of talk to each other, and they're the ones that control blood pressure.
Okay.
So when you have only one that's high, so let's say you only have high aldosterone and low renin, or it may be the other way around, but when only one is high, that's indicative of like adrenal fatigue or Addison's, where it's like kind of a cortisol crisis. But when both are elevated, aldosterone and renin levels, that's indicative of kidney stricture. So then they're telling me, well, we think that you might have some type of stricture in your kidney. I went for an MRA, an MR angiogram of my kidney. They didn't see anything. So I'm like, okay, well, what now? I went down the gamut. It was urologists, gynecologists. I saw a psychiatrist at one point. My
Hmm.
doctors were just like, maybe this is anxiety. Maybe this is postpartum. The only thing that panned out of that is that, all we did was talk about my pain. Endocrinologist, nephrologist. The doctor who did help me, where we finally broke ground, was the interventional radiologist.
Hmm.
They ended up running what was an MRV, that's a MRI venogram, which is just imaging of my pelvis, and it looks at my veins. And I don't think it looks at arteries. I think that's the angiogram, but I could be mistaken. At any rate, when they did, they identified several compressions, which was kind of unfortunate because they'd never been seen for the last 3.5 years until just now. So it's been a long time coming. And I asked my doctor why no one had caught it for the last 3.5 years. He said that it's something that really these radiologists, interventional radiologists need to be trained to look for, or they'll miss it. Absolutely.
Hmm.
So my compressions so far are May-Thurner syndrome, which is an iliac vein compression. Um, the iliac vein is the one that kind of processes the blood between your legs and back up to your heart. Mine's squished. The other one that I have that's a little more rare is called posterior nutcracker syndrome. That's where the renal vein is compressed between the aorta and the spine. Um, because it is where it is against the spine, stenting is not an option. So I said, well, what is the best option? I was given two options. One was for left renal vein. It was a LRVT, left renal vein, um, uh, where they transplant the vein to your kidney, a fresh vein. I heard that has a very low success rate. The other one was uh, renal autotransplantation, where they take my left kidney and they transplant it to my right side. Um,
Wow.
yeah. So to go from no answers to now we're talking, I'm going to be meeting with a vascular surgeon and a transplant surgeon in the next 2 weeks is crazy. So yeah, and so what they're gonna do now is that they identified those in imaging. What they do is they do a venogram with IVUS,
With
intravascular
IVUS, yeah.
ultrasound.
Right.
What's that?
It's a camera that goes in and it uses audio waves, I believe, and then it
Yes.
is able to really get a good 3D picture of what's going on inside the veins.
Yes, exactly. And right now, I guess that's, that's the gold standard for treatment and even placing stents so that they know where to place them properly, the size, all of
Mhm.
that. Um, I was recommended to never get a venogram or like stenting placed without the IVUS. So that's something I really looked for. So that's my next step. I'm next week actually, I'll be in downstate Michigan and I will receive the venogram with IVUS. They will determine the compressions in entirety and then make a plan from there. But they're going to also be looking at my inferior vena cava. That's another one that may be compressed.
Right. Oh, really? That's a bad one to be compressed. Don't
So
you
this is
find?
going to get really interesting for you guys, and I'm not sure if you're familiar with this, but um, I searched high and low for the interventional radiologist that I have now. They're not all built the same.
No.
And I was in another support group that I have, and he was really highly touted. So anyway, as he was the one who identified all the compressions. We talked, and I said, how is this even possible? It must have been the pregnancy. I had my son in September of 2020, and he said this was surprising. He said that when he sees multiple compressions, that typically goes hand in hand with Ehlers-Danlos syndrome. There's 13 forms of Ehlers-Danlos, and one of them is called VEDS, vascular Ehlers-Danlos. Um, so now I'm going down that that whole gamut of
I don't even
getting
know what that
genetic
is.
testing.
I'd never heard of it. John, have you?
Yes.
Yeah, it's a form of typically in the arteries where there's issues within the arterial walls that can lead to aneurysms and sections and things like that. Folks have
Yes.
very specific phenotype for it, though.
And coming up right here on the Heart of Innovation, we are going to talk more with Steph about her story and also get into the intersection between genetics and nutrition. So stay with us.
Thanks for joining us today, everybody. We are continuing our conversation with Steph Vukovich, micronutrient expert and health coach, who in the previous segment was telling us about some of the venous congestion and constriction issues that she's been dealing with that sounds like have been leading to some lower extremity swelling. And ultimately, you've got in touch with somebody who is going to do a little bit more investigation, work, and some imaging to see if you might need intervention. So I'm glad you finally, you're in the rabbit hole, but it looks like you're not digging any farther down, right?
Right. It's good to finally have answers, even though they're not great. It definitely affirms what I was feeling and what I've been going through. I think that was the hardest was not having answers. But what was interesting that I didn't get to mention with the renal autotransplantation is not just my renal vein, but my renal artery is also squished for whatever reason. So, yeah, very
Huh.
very
That's
strange.
that's
Yeah.
that's a new one. I'd love to
Mhm.
on a not a voyeuristic request, but it'd be interesting to see your images. I'm curious about that one. Um,
Yeah.
But so tell us a little bit about what you do as a micronutrient expert and health coach and how that kind of got you thinking about, what's going on with your body.
Good question. So, okay, so And I'm gonna read this because I'm a little shy, so a little nervous. So my job as a nutrigenomics coach and counselor is to interpret genetic material, typically raw data, identify variants in the data, and teach clients how best to support those variants so they should work as they should. Examples would be like MTHFR,
Yeah, they
MTER,
the
MTRR.
MTHFR is basically if you have this gene, your body struggles with turning food into fuel, and so I believe your B vitamins aren't absorbing. You're not turning that folic acid. A lot of our breads and things are enriched. Pastas, they're enriched with folic acid, but your body can't turn that folic acid into folate. So so you end up with an enzyme that doesn't get broken down in this digestion process, and it's called homocysteine. And when there's too much homocysteine, it's almost like nails is what so I have it, my dad has it, and I think my older brother has it. And they describe it as being like nails on your artery walls. And when you have damage in the artery walls, that's where those small LDL particles can get in there and start building up and pushing that wall up and creating restriction in your blood flow. And John, you're always welcome to correct me if I'm wrong. That's just the way the dietitian described it to me for us.
I don't claim to know much about diet and the way things are broken down, other than that, a good Mediterranean diet is something that we preach in caloric restriction. But yeah, I think what's interesting to me, Steph, is the fact that you're taking what sounds like pretty complex information
Yeah.
and translating it into like a sixth grade level, I would imagine, for patients. What is your educational background, if I may ask?
So I'm an LLNC right now, limited liability nutrigenomics coach. It started out just as a patient, like anybody else looking for answers. Nutrigenomics is relatively new. It's about the last 10 years or so, say 10, 12 years. And at the time, with genetic testing, you get the results and it's like, okay, you can either take them, you can panic about it, or I said I wanted to learn how to best support them. Like, how can we change this so that they can work as they should? I started in groups, working with people. Eventually it's really just it's blown up. I work she's my mentor, colleague, one of my good friends. Her name's Bailey Farstead. She's the creator of Norns. She has a master's in nutrigenomics and biophysics. She's also she's let me see here. I had her. I'm sorry, I'm a little nervous.
That's
Um,
okay. We're
she's
just
We're
live
also
on
always
the radio.
nervous.
That's all.
Oh, yeah. Yeah. Yeah, no worries. But she's also the head of the Fibromyalgia Research Board over in Oslo, although she is American descent. So I work with her. As I was working with her, I started to work with a lot of other physicians, and counselors. Another thing is nutrigenomics spills over into estrogen metabolism, perimenopause, menopause. COMT, the catechol-methyltransferase gene, is responsible for estrogen metabolism, estrogen catechol, methyl donors. There's a huge list. I would have to read it. But so at any rate, I delve deep. After a while, I've become kind of a staple for people, to direct them for sources. I help interpret genetic panels. I help direct people to sources as needed.
Right. So
So
basically, when they have these genetic snippets that may not be normal, you're able to say, okay, well, here's some action that you can take. Here's some resources that you can use to help make a difference. Because a lot of people that end up coming to you, like, in our case with my dad and the MTHFR, that we were really trying to get to the bottom of what are all the factors that are damaging his arteries, leading to that plaque buildup. And most general mainstream, facilities don't deal with that. They say, you have heart disease. These are your options. Here are the pills. Here are your statins. Here are your blood thinners, your anticoagulants. And, oh, if you need an intervention, we'll do that. If you need a bypass, we'll do that. But for me, a lot of people want to step back and go, okay, what has led to this? and there isn't as much, research, into, a lot of that. And so there are some natural means. And that's what I was trying to figure out, how do I empower my dad to take action for his health? And the only way to do that was through genetic testing and being able to give him some actionable items where he could, see in his blood work there were improvements based on his action, and we were able to find that. And
So
are you finding that with a lot of yours?
just real quick, walk me through that. Uh, if a patient came to me and said they want genetic testing, I mean, for me, when we talk about genetic testing, it's actually looking at somebody who may have
And as
problems
curious
with.
as Dr. John is, we are going to have to go to commercial break here on 860 AM The Answer. Keep listening on for the Heart of Innovation with Kim McNicholas, Dr. John Phillips, and their guest, Steph Vukovich.
Welcome back, everybody. And before I was so rudely canceled by our producer, I was trying to ask a question for Steph and Kimberly.
Colin's got to keep you in
He
line.
does. He does. So explain to me how, if a patient came to me and said, I want some genetic testing for my cardiovascular disease, what am I supposed to say to that person, since I don't personally do it, and nor do I know much about it?
Right. Well, so a lot of times providers will just refer out to a geneticist. I mean, that's the default. You could do that. There are options though. So there's commercial testing, which everyone knows. That's testing such as 23andMe or Ancestry. That's considered exploratory testing. That's a good jumping off point actually, and I'll explain in a second. The other one though is clinical testing. Now, the difference between them is actually huge. It boils down to cost and the amount of information garnered from the test results. So, clinical testing does not offer raw data, um, which is super. I mean, it's so invaluable for further genetic identification. Raw data is a compilation of about 600,000 to 700,000 genes and variants, ranging from cardiovascular all the way to pharmacological interactions through the CYP450 pathways in the liver. Um, Commercial testing is
All
not.
Greek to me.
So the CYP450 pathways are liver pathways that help break down medication, hormones, toxins, heavy metals, everything you can think of. Um, so anyway, so clinical testing isn't typically covered either, as you had mentioned earlier. Sometimes it is. It depends how you do it. So, but if I were to recommend for someone starting out, especially if they're not sure if they really want to go down that route, and they're just kind of curious, would be to do commercial testing. And
Like the
again,
23andMe.
correct. 23andMe or Ancestry. You do not need to buy a membership. You do not need to buy the most expensive package to get your raw data. Literally the most basic package, no membership, they will give you your raw data. Right now, the only problem with 23andMe is that they've really locked down their raw data feature, so that instead of just freely downloading it out of your profile, you have to contact them and have them email it to you. That may be.
Knowing that that's what you need to do, you just go ahead and do it, right?
Right, right.
And I think
Now,
that company's going bankrupt, actually.
Well, they
yes,
just have data leak after data leak after data leak, and then they went and they sold a bunch of people's information to a pharmaceutical company. So I still
Sure.
have my kit here, which I heard would have helped me, in a less expensive fashion, to learn about having the MTHFR mutation. And I just left it there and went and paid the full price, at my local, just walk in, and got it done. I think it was like $180. It was very expensive. But it does get concerning, Steph, for people, with those facilities. I mean, has Ancestry had the same problems, or have they been a little bit?
no. So as far as 23andMe, what happened was, at the beginning of the Israeli Palestinian war, someone was able to hack into their system. What they did was they threatened to leak Ashkenazi Jew heritage from the 23andMe site. I 23andMe says that it didn't happen. There was a threat, but it never made it that far. It's hard to say, but what I will say is that Originally, I would have told you, you can do 23andMe anonymously. You can go in as Jane Doe and get your results. Go into your profile and download your raw data. Right now, that's not an option. You actually have to prove you are you to receive your raw data. So I wouldn't advise using an alias if you use 23andMe. But right now, it is still an option. 23andMe, it does have several genes that are FDA approved, and so like the panels. So it is a good test, and it's very universal. So there's genomic panels online where you would upload this raw data. And when I use the word upload, I use that very loosely because you're not actually uploading, you're kind of running it through. So it's never saved. It's anonymous. They don't have you sign up for anything.
So
And
Steph,
when
let me
Mhm.
just if I can
Yes, I'm
if you
sorry.
can explain this to me like I'm a kindergartner, because I'm having a little bit difficult time kind of understanding what. So let's say I pay for the test, right? I get a
Okay.
test from 23andMe or whatever. Now I get these results back.
Okay.
What am I supposed to do with them? Give
So
them
you're gonna
counts,
get
talk to
okay.
you?
So you're gonna get the 23andMe results.
Okay.
That's where you open up your profile and it looks, it's this whole thing, and you're going through and you're going, "Oh, I have an iron deficiency in my family," or "I have this." So
Okay.
there's that. Then there's raw data. Raw data is just the most basic PDF file of it's RSID numbers, which are gene variants, but it's 600,000 to 700,000. So,
Wow.
so what
So
you
after my head explodes, then what do I do?
so
And then
you
there
don't look
are
at that.
sites, right? You can go to different sites, and there are
Yes.
sites, there's a couple of them that I think that they're even donation based. You go in there, and like, for example, with what we did with my dad's MTHFR was you don't see straight on the 23andMe results that you have this MTHFR mutation. What you have to do is go, and they have some sort of algorithm. You can calculate it yourself. There are formulas online, or you can put it into this one website and say, hey, take my data, do the calculations for me, and make sense of all of this information, and it crunches all the numbers, and it says, based on what we figured out is you have this MTHFR mutation, for example. And then that's where also I think, Steph, you're able to guide people. You're able to say, hey, I'll take that information, I'll upload it for you, I'll help you make sense of all of it, and then I'll give you some sort of practical strategy, if there is a practical strategy in terms of nutrition or whatever they're eating or supplements that they can do in order to counteract the impact of that genetic mutation, such
So
as with MTHFR.
okay, so then so Steph, let's say I do this and
Mhm.
give aside from the MTFHR or whatever, that mutation, give me another common one that I might have.
Oh boy. Okay. So everyone has a comp gene. So there's the MTHFR, which she was talking about.
Okay.
Now, COMT is right next. They're like brother and sister. COMT controls. Let's see here. It's the catechol estrogens, heavy metals, toxins, methyl donors, metabolism. What that means
So let's say I
is
have a defect in that or something, right?
well, so everyone has a status. There's 3 statuses for,
Okay.
Val 158 Met, which is there's slow, balanced, or fast. So that's how these genes express. It's not like it doesn't work at all. It will either be very slow, intermediate, or it works faster than it should, which means it may potentially clear, catechols or dopamine, adrenaline, norepinephrine, it may clear those very quickly. So anyway, yeah,
Let's say I have one that's slow. What
mhm.
do you what would you recommend? I guess I'm just trying to walk it through for our
Yeah,
listeners. Like
yeah,
how
absolutely.
do we get
So
some value out of this?
yes, that's a great question. So slow comped, if you have slow comped, which about I would say a third of the population does. I mean, there's only 3 variants that you can have. And I tend to run into people with slow comped quite a bit. In fact, my mother is. That seriously impacts estrogen metabolism. Because it impacts estrogen metabolism, not only that, but toxins, heavy metals, the catechols. That really increases oxidization and it increases the carcinogens in your
Oh,
liver
wow.
and stuff because you can't
Coming up on
detox.
the Heart of Innovation, we're going to figure out the last bit of information here with our host, Steph Vukovich. Don't go anywhere. You're listening to 860 AM, The Answer.
Hi, everyone. Welcome back
Welcome.
to the show. And we have Steph Vukovich with us. And before the break, we were allowing her, she has this COMP gene that I think it's called. And it's not a matter of if you have some sort of mutation, it's just a matter of which mutation you have. Do you have a slow, intermediate, or do you have a fast gene? And that affects the is this just for women or is this for both men and women in terms of their estrogen absorption that ultimately impacts the amount? Like you were saying, that if they have slow, which a third of people possibly do, that they have more carcinogens and such that are not getting, you know, flushed out of their system.
Yes. Yep. It definitely affects men also. And I work with quite a few men. See, what the thing about slow comp is it's also called the warrior gene. And it's true to its nature because typically when I work with people with slow comp, they're more of a worrier or they're more high anxiety. That's also the decreased catechol metabolism where they have higher adrenaline levels, higher, so yeah, it definitely affects men and women for sure.
Mm.
Um, One of the big things I want to bring up about COMT is that with MTHFR is COMT determines whether you can metabolize methyl vitamins efficiently or not. People with slow COMT cannot metabolize methyls, catechols, methyl donors such as like L-theanine or
What
in
is that?
green tea. L-theanine, it's an
Yes.
amino acid.
Okay.
Methyl don't yeah so
So
anyway,
what do
but
people do once they find this out? Is this something that you then say, okay, here are the supplements you need in order to help counteract this to make sure that you can metabolize you use proper, you make sure you them up with a system where they can properly have that right combination of supplements to counteract that, right?
absolutely, yeah. We can look and say, okay, so you have an MTHFR gene. Now, a heterozygous status comes with a 30 to 40% decrease. A homozygous status comes with an 80% decrease. So you can look and say, okay, you have an MTHFR gene. Now, you probably shouldn't have folic acid. Another one that determines folic acid would be the DHFR gene. Um, and so, yeah, I'm sorry.
So if people are not figuring out, so the whole moral of the story, we have only about a minute left, is really that if you can't figure out what's going on or you want to get to the heart of what is causing it, there's always some sort of genetic factor that may be causing it. And if, to find it out, it might be a matter of how much you can invest into the genetic research and then the genetic analysis, and ultimately beyond that, the coaching to make sure that you can create a strategy to be able to counteract any of those gene snippets that might be leading to whatever chronic ailment you have. But I know, like with some of these, genetics, John, the cool thing is the ones that we found, at least with us, is we have been able to find natural ways with supplements to counteract the impact, such as I mentioned quite a few times, the B vitamin injections, and then the liposomal injection, the liposomal B vitamin underneath the tongue.
Yeah, again, I think that knowledge is power, but you just have to be careful. This is just my own editorial, but you have to be careful. We have the saying garbage in is garbage out. And so I guess if you're getting this type of information, you have to find somebody that can help guide you with, what to do with it and how not to drive yourself crazy or, just kind of, I mentioned the rabbit hole. I think that that's really, really important, but there's value
Yep.
in this information, and there's value in changing something that's modifiable in your
Right.
risk profile to lowering the incidence of cardiovascular. So the thing that I was reading, because I was supposed to do an interview about intermittent fasting, okay? And so the death rates from cardiovascular disease over the past, many years have gone, it was going down, but the mortality rates are actually going up in people 35 to 65. And it's
Huh.
because we're eating too much and we're not exercising. And so, the something simple as changing the way you eat or reducing the amount of calories can make a huge dent in your risk for having a cardiovascular event.
Yeah, I agree. John was just making some really, really good points, just, on the fact that um you can either garbage in, garbage out, you gotta, it's, especially with these genetic snippets, you really do need to make sure that you're being more conscious about, and that's probably one of the benefits of doing it, is that you are more conscious about what you're putting in, and that you in more of the right stuff versus the wrong stuff. Because even for me, with a few other genetic things that I discovered about myself, I can't have zucchini and mushrooms and avocados and a few other things that just don't react well with my body, which is very interesting. And I know that it's hard because thank goodness I actually was able to get that testing covered through my insurance, or else I wouldn't have been able to afford it. But not everybody has access to that kind of testing. But I want to get to, I know, John, you had a few questions before we get to some of the other ones in regards to which I kind of want to hear a little bit about, is your new men's health um, business that is offering these injections, and how you determine which injections people are getting. And, do you work with coaches or other doctors to see, or do you do blood work ahead of time to determine what these people need?
Well, I mean, I think that's what I'm trying to figure out, because there was a comment in during the show of, I mean, there's supplements everywhere, TV, Instagram, you're just constantly getting bombarded by ads for things. And patients ask me all the time, and frankly, I always tell them, probably these aren't going to hurt you. I mean, if you took a vitamin, or if you, like coenzyme Q, for example, is something that we'll recommend in patients who are on statins to help with the metabolism of it and some of the side effects. But, other than that, I don't really recommend much. And so, we offer vitamin B12 injections, and like a triamino acid kind of complex. And again, I just want to make sure I'm doing what's right for the individual, and not just trying to peddle some injections that aren't gonna be of benefit for them. And so the B12, I think, is pretty well recognized as something of value. But some of these other things I'm not 100% sure on, and I'm still trying to learn about them.
Yeah, Steph, do you have any guidance on any of that?
So typically, I would warrant against using high dose B vitamins of just one kind, like B12 or just folate, high dose folate. But I have seen a lot of high dose B12 injections help people, especially with pernicious anemia, or people with MTR mutations who have issues with B12 and methionine. Uh, so yeah, I mean, I think the biggest thing that's important is with the B vitamins, especially with methylation, is B vitamins are super synergistic. So you can't just take one. You can't. So B6 needs B2, but B9 and B12 need B6 and B2. They all need each other, and they're all supported by magnesium. So I would say if you're doing mega doses of B12, you definitely want to have appropriate cofactors with that. Um, yeah.
Okay. Yeah. We'll have to talk offline.
Yeah, and how to do that with those injections, because I
Yeah,
didn't even
yeah.
know that either. I was just doing the
Oh,
B12 injections.
so if you don't complete the methylation cycle and you're only taking, like, let's say you're doing just a folate supplement, that unmetabolized folate accumulates at a homocysteine and it becomes harmful in your system because it can't
Mm.
be broken down. The same with, so when I was diagnosed with MTHFR, I kept continuously having normal B12 serum levels. They were always normal, and everyone would say you don't
Mm.
have any B12 issues. And then they ended up doing an MMA test, which is the methylmalonic acid test, which checks how much B12 is actually being utilized by your cells in your liver. So the active form. I was so deficient. Serum
Wow.
testing does a disservice to people because it's very erroneous. It can reflect one thing, but that's not really happening on the cellular level. Does that make sense?
It's interesting because I don't know if you can still hear me. It's interesting that you say that the basic testing that we get done in the general lab, such as just the B12, they think, oh, okay, you're fine. You have nothing wrong with your B vitamins, but no one thinks to go further than that. And I find the same, and I'm curious on Dr. Phillips in his view as well. But I hear so many times in our groups, oh, I'm fine because my cholesterol is fine. I used to think the same thing until my dad's GP said to him, I'm not testing you for heart disease because your cholesterol is fine and you can't be at risk. There's nothing harmful going on in your body. And it wasn't until we got an advanced lipid panel where they not just tested the quantity, but they tested the quality, and they described it to me. The dietitian described to me in this way, where you could have a whole bunch of large fluffy ones and you could have high levels of those and never be at risk of heart disease. But if you have a lot of these small, dense LDL particles that when they become oxidized by trans fats and free radicals, they tend to be little troublemakers, and they can infiltrate the damage in your arteries and then push that wall out and build up calcium inside there. And I have to keep repeating this in the group, but that just because your basic lipid panel says you're fine does not make you fine, because it's not just about the quantity, it's about the quality. And you do need a lot of HDLs to carry those LDLs and excrete them out of your system. So if your HDLs are low, well, then you're going to have this misbalance. You're going to have more LDLs in there that are getting into trouble.
Yeah. So,
But
I'll just say, fantastic point. And I got to run after this because my son needs to get picked up. But I send probably all my patients to a lipidologist because I don't have
good for you.
frankly, I don't have the time to go through their cholesterol in an appropriate manner that is beneficial to the patient. For me, as a cardiologist, we're seeing patients, we're looking at their LDLs, we want them as low as possible. In fact, dogs don't have measurable LDLs, and they don't get heart disease. There's actually there's an indigenous group of folk, they're almost of like Eskimo ethnicity, that have like no LDL, and they don't get heart disease. But what's worse is you may have a decent LDL, but a low HDL. The HDL is something that we can't fix. We can't make more of them yet. And that puts you at a higher risk of heart disease than somebody who has a high LDL and a high HDL. Yeah. So bottom line is, you get your cholesterol checked, and then, you can ask for the nuclear kind of evaluation.
Nuclear resonance, NMR.
Yeah. NMR, they'll get all that stuff for you, and then go talk to a lipid specialist. And I'm not doing the patient I'm not helping my patient by being like, oh yeah, here's 40 a Lipitor and see you later. It's like, hey, let's understand this, and then let's figure out ways to get it going. So anyway, thanks guys. Have a great weekend.
Thank you.
That's fantastic. Even more reason to love Dr. John.
I love it.
Seriously. I am so proud to call him a co-host. Stephanie, I'm gonna let the everyone else take the floor here. You had we had questions coming in about H. pylori. We had questions coming in about calcium and D vitamins, and I know that Douglas has so many questions about just general supplements, and I have a feeling what you're going to say. The generalized supplements, the Balance of Nature says it covers everything you need. Maybe you can talk a little bit about how these supplements are absorbed, and especially, I was told, for example, Centrum, that there was a study that was done, and that's not even at least the previous one was never even being absorbed in the body, that plumbers were actually finding tons of these, not even broken down in the sewage systems, that they have to clean those out, all of these supplements out, because they're not even absorbing in their body, they're going right through. So it'd be interesting if you can address some of these generalized supplements as well. But I'll let you start in and get that conversation kicked off.
Yeah, so I did take the list that you gave me and I kind of broke it down. I gave my opinions of everything, kind of a rundown of what I did know about it. Again, if it doesn't correlate with nutrigenomics on some level, I may not be familiar with it because I'm not a full nutritionist. I deal with the genetic part of it, but being a patient and also dealing with the cardiovascular aspect of genetics, I am familiar with some supplements. So the first one is CoQ10, which I know we've talked about. The most bioavailable form of CoQ10 to take is ubiquinol. That would be preferred over ubiquinone, which is oxidized. Um, Ubiquinol dosing typically is like 100 to 300 milligrams a day. But I would recommend ubiquinol over CoQ10 any day, especially if you're having absorption problems. Um, let's see here. Nattokinase. So that'll tie in with K2, which we discussed in group before. But so nattokinase is an enzyme that's harnessed from the Japanese dish natto, fermented soybeans or chickpeas with Bacillus subtilis varnado, which is a bacteria. Vitamin K2 is derived from natto. But nattokinase is because nattokinase has been isolated from natto, there is no K2 in nattokinase. They're separate. So nattokinase and K2 MK7 have, or just the K2s in general, have separate but complementary properties. So nattokinase's primary role is blood flow by breaking down what's called fibrin, a protein that's involved in the clot formation in the vessels. K2's primary role is regulating calcium metabolism by supporting the formation of osteocalcin and facilitating the removal of calcium from vessels and arteries to the bones. That one is so huge for cardiovascular health. K2, I can't stress it enough. Which leads me on to the K forms. So when you hear vitamin K, you think coagulation, blood clotting. In fact, a interesting thing is that vitamin K is actually named after coagulation, the German the German name for coagulation. So you would think that's what it does. But there's different forms. There's 3 forms of vitamin K, just like there's different forms of vitamin B, and they all have different properties, but they all work towards the same goal. Vitamin K has 3 forms. Only 2 that are readily available to humans for consumption. Vitamin K3 is actually only found in like animal food products. It's found to have toxic effects on like oxygen, carrying red blood cells. It causes liver damage. So you won't hear of vitamin K3. You can't even find it. So vitamin K1 primarily comes from dark leafy greens, such as like spinach or kale. That is the vitamin that promotes healthy blood clotting. Dosing for vitamin K1 is typically 100 to 150 micrograms daily. Now, I don't know how that fits into the window of like peripheral artery disease. But moving on, as far as atherosclerosis goes, vitamin K2 is the preferred route. So
Right, and you
what
take
that's
that K2 in conjunction with, like, a D3, like, for me, and then I'm curious, just the K2 and the MK7, I don't understand why I'm doing both of them, but thanks to you, actually. I had a nurse practitioner, that I see over here in Marin that told me that I needed to stop the K2 after I had a reaction to the COVID vaccine, and she said, "No, I'm really concerned about you. You're at a high risk of clotting, so you need to not take the K2 MK7." And then talking to you and talking to also my brother who's very well researched, they were like, "No, no, 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 no. with the atherosclerosis that is genetic to you, like you need to make sure that you're taking that, because I also have a vitamin D deficiency. So he was like, it's just not going to absorb properly in your body and you're just going to get more calcium is what, I was told. So now I'm back to taking D3, K2, MK7 all in one tablet.
Awesome. Awesome. Yeah, great. Yeah. So there are like 12 different kinds, 12 to 14 different kinds of menaquinone. So MK7 stands for menaquinone 7. Menaquinones are like a branch amino acid of let's see here. Um I have to kind of look over my notes sometimes too. Yeah, so menaquinones are a group of molecules that are identified based on length of side chains, and they range from MK2 to MK14. But the two most recognized forms of MK are MK4 and MK7. So I run into a lot of people who say, well, MK4 is better. So you will find MK4 is very bioavailable, but the problem is it has such a short lifespan. It goes right through you. It metabolizes in 4 to 6 hours. So how much is that really going to help you throughout the day, especially with calcium accumulation? So if utilizing MK4, you want to use it several times a day. Typically, the dosing for MK4 is 15 milligrams 3 times a day for a total of 45 milligrams. The reason I bring this up is some people can't take K2 MK7, whether they have histamine issues, because fermented foods increase histamine production. MK7 is derived from fermented foods such as natto or sauerkraut. So people who can't take MK7 can take MK4, but they just have to dose it differently and more often. So that is something worth noting. But one rule of thumb for, and this is for only MK7 only, is 45 micrograms for every 1,000 IUs of D3. So if you're taking 10,000 IUs of D3, you need roughly 400 to 450 micrograms of MK7.
So it's always better. I find it's better just to get the ones that are all in one, because then it's already measured out for the most part.
You would think so.
I'm a little
So
lazy. I can't do
you would
math.
think, yeah, so you would think so, but I have found that, it's not, I don't want to call multivitamins or compound vitamins snake oil, but boy, do they not do their research when they compound these. I mean,
Mm.
I was just talking with my friend the other day about, for example, like P5P, which is the active form of B6. They sell that as 50 milligrams, 100 milligrams. It'll be in supplements at 25 milligrams. That is so toxic. People are just begging for trouble at those doses. Or on the flip side, with D and K supplements mixed, you'll see the K2 level is way too low for your needs. And which I don't want to just assume, but you may want to check your supplement, because typically they'll do something like they'll go 5,000 IUs of D3 and then it'll be 100 micrograms of K2, which is nothing. It's a drop in the bucket. So since I've started to kind of go down this journey, I definitely supplement everything separately, which it's expensive to start up, but you don't have to refill everything every month. Sometimes they're 90 days, it's just
Kim is wondering, is it safe to take vitamin K with a blood thinner? What if you're on anticoagulants and blood thinners? And I just want to take a moment to remind everybody that these are things that you do need to have a conversation with your own doctor and before acting on any information that you're getting during this broadcast, because we don't know your particular situation. And it's not just about, okay, will it interact with your particular blood thinner, but there's so many different combinations of blood thinners, the antiplatelets, the anticoagulants, then on top of that, other medications, blood pressure medications. There's also statins. There are a lot of combinations. And so it's really important. What I always suggest is to make sure not just your doctor, because your doctor may not know, your cardiologist may not know, your vascular surgeon may not know the answer to the potential ones. A great person to ask is your pharmacist. And then also ask for a referral to not just a nutritionist, but to a dietitian. And there are even dietitians that have PhDs that are even better, that can really dig into the deep end with you on the potential interactions or contraindications for any of the supplements, with your current medications that you're taking. So it's really important, because then you can dive into your own medical history. They have the charts in front of them, and they could probably give you a more customized answer. We can only talk right now just in generalities. So just take what we're saying, with a little bit of a grain of salt, and make sure you do write some of this down, and we can even help you with some critical questions to ask your doctor to determine if this is some of this information is right for you. That being said, Steph,
Wonderful. No, I appreciate that. Yeah, that's a great point. So when approaching any of the information that I'm giving you guys, I'm just speaking off the cuff. This is not necessarily for people who are on serious blood thinners. I would definitely double check with your doctor before taking any of these routines, these regimens on. But they are tips, for the general person, as far as lowering cholesterol, lowering cardiovascular inflammation, glucose regulatory action, that kind of thing. So moving on, another one that I do have on my radar is resveratrol. I'm not sure if anyone's familiar with that.
yeah,
It's
that's wine. I'll drink more wine.
yeah. It's a polyphenol compound, not just found in grapes and berries, but also peanuts, which is interesting.
Hmm.
So yeah, it's known for its cardiovascular protective effects, glucose lipid regulatory action, antioxidant, anti-inflammatory, and anti-cancer compound abilities. It's also been considered a potential treatment for non-alcoholic fatty liver disease, but that's just something that popped up on my radar. There's not a lot of science behind it yet. They have more research to do. So the bioavailable and preferred form of resveratrol is actually trans-resveratrol. Resveratrol does lower total cholesterol and LDL while increasing HDL, reducing factors for plaque rupture and preventing blood clotting. So resveratrol is considered an estrogen receptor mediated transcription agonist. This means that by binding to the estrogen receptor, it has ability to either act as an agonist or an antagonist, like phytoestrogens do. So I always look into that, because I deal with estrogen metabolism. But also, it's important for people who have estrogen dominance or estrogen positive malignancy, and want to avoid the excess estrogens. Dosing for resveratrol or trans-resveratrol is typically 500 milligrams to 1 gram, depending on the needs. But very important, those with hypothyroidism and hypothyroid conditions should refrain from resveratrol. It has an affinity for acting as a thyroid disruptor. It decreases the expression of thyroid-specific genes. So that's not a great option for people with thyroid issues. Moving on, another one that's a favorite of mine. This is a big favorite, is pantethine. So pantethine is the bioavailable version of pantothenic acid, which is vitamin B5. So as I said, bees have all different functions. B5 it's not involved in methylation. So that's not part of the MT-HFR equation or anything. What vitamin B5 is a part of is it contributes to adrenal health. So pantothenic acid contributes to the adrenal health, but it does not contribute to cholesterol metabolism. Pantethine does, though. Pantethine is typically added to plant sterol supplements such as Cholestoff. I believe Cholestoff Complete has it. They label it as the patented version called Pantocin. So at any rate, the whole spiel with that is pantethine is wonderful. It can lower cholesterol by 20 to 40%. You can look at reviews about it. People just rave that they've taken half the dose they should and it's dropped their cholesterol. So that's something that I'm actually using myself, and I hope to recheck my cholesterol in a couple months and see improvement. But before I move on, like I said, pantothenic acid does not act the same way. That is for adrenal fatigue, but it does not lower cholesterol. So, going through the list, I see olive oil. I don't have a lot to say about that. I have read phenols in extra virgin olive oil can prevent blood clots. Interestingly, though, in my research, I did come across that extra virgin olive oil absorbs calcium, really draws it into the body. So that's something to consider also. While it may facilitate, blood thinning properties, once again, you want to institute a good K2 vitamin with that. Extra virgin olive oil is also very high in vitamin E. Let's see. I have beetroot powder. That one is a popular one. That one we've
The
talked
beetroot
about before.
powder is really interesting because I heard that really helps with HDLs. And the only thing that struck me is when I saw your comment also in our group and the discussion about it is that I didn't realize, and especially for someone, I want to have kids at some point. I'm always very conscious about the metals that I put in my body. And you mentioned that
Oh,
because it's a root that is very high in metals. And while it might be good for my dad, and I try to put it in his smoothies, that maybe I shouldn't be consuming as much of it.
so yeah, so we could talk all day and all night. So this could go back to the genetic portion of it, where when you do the genetic screening, you can identify whether you're a poor metabolizer of these heavy metals and things. That really makes a difference. People with like a fast compt, and there's quite a few other genes involved, but those people, they clear estrogens almost too quickly. They clear heavy metals very quickly. So that's why when people take stuff, so one person will be like, well, that worked fine for me. Other people are like, oh, that didn't work for me, because, on a genetic level, it's really how it's working for us. So with heavy metal toxicity, it wasn't on my radar before until I became a nutrigenomic counselor. I'll tell you what, I mean, the damage that can do and the amount of time it takes to clear heavy metals is astounding. So not to go off topic, but on topic, with heavy metal poisoning was my first encounter was I received a copper Paragard IUD after my pregnancy. First, I didn't notice. Within about 6 months, I started feeling like a humming in my body, a buzzing feeling. It was really strange. And I kept telling my doctor, and he's like, no, it couldn't be, whatever. I asked to be checked for my copper levels because it is a copper IUD. He said, no, you don't have Wilson's disease. Don't worry about it. About a year to the day after I had it put in, I had it removed, and they checked my copper levels. My zinc levels were tanked, which is antagonistic with copper, but my copper levels were through the roof. It took me 2 years to clear that copper out of my body,
Oh my
where I
goodness.
didn't feel like I was humming. I didn't feel like I was having panic attacks constantly. My hair was falling out in chunks. I can't stress enough. I thought the right thing to do would be to purchase an HTMA test, which is a hair toxin mineral analysis. It's a good overview of things, but it doesn't. The better testing is still like for copper poisoning would be ceruloplasmin testing with a copper serum. But anyway, so the whole spiel is this, yeah, heavy metals, man, they are rough. And when you get sick with them, it's hard to, you may have to go through chelation procedures where they have to actually like run your blood through this thing and remove all the heavy metals. It's crazy. So to avoid as many heavy metals as you can is really important. I mean, beetroot powder, yeah, it's going to have heavy metals. It's a root vegetable. But as long as you're not, taking it every day, all day long, max doses, you should be fine. Everything in moderation.
Okay. We do have quite a few questions. Can we jump to those? Then we'll get back to some of the other. I want to let,
Absolutely.
I know Douglas has some, and I know Rebecca just jumped in, and Nancy. Douglas, do you want to jump in with a question? And then we'll get to Nancy and Rebecca.
Go ahead, Rebecca.
Okay, I was curious about the resveratrol, or however, I don't know if I'm saying that right, but
Resveratrol.
resveratrol. If you have hypothyroid and everything, you had said like to steer clear. Is that even if you're taking thyroid medication and you're well controlled, is it still a no?
I would say don't.
Okay.
It's going to make your medication less effective.
That makes sense.
You know what? It could be that, you could take it, but your doctor will have to exponentially raise your dose, which you don't want either. So, going through, and I don't know if I'll be able to cover everything, but I do have a lot of great alternatives. So you don't have to focus on resveratrol as being an only option. Yeah.
Okay.
There's other options for you.
Okay. Awesome. Thank you.
Yes. Thank you.
Nancy, what's your question?
I'm a diabetic, been a diabetic for over 20 years, and I'm just wondering about berberine because that's what I keep hearing about. I will have to tell you, for years, many, I take a lot of supplements. I feel pretty good. I do a lot of research on them, but now I'm adding more. And when you're buying medications and then trying to buy supplements, it gets expensive. So I'd like to get my list down, but now today I'm adding more. So, but I'm wondering about the berberine, what you know about that.
Yeah. So berberine, I mean, they call it nature's Ozempic. Berberine, it's touted for potentially having weight loss abilities by reducing appetite. It can reduce blood sugar, cholesterol. I thought I had it somewhere in here in my notes, but maybe I missed it. I will tell you, as far as berberine goes, and this is not the norm, but it is it's a quaternary ammonia-genic compound, which means it's ammonia based. People who have trouble with metabolizing ammonia, whether it's a urea cycle disorder or anything else, may have trouble taking it. I know I do because I have that, but that is not the norm. So I don't want to really put that out there as like the common info, but something to watch for sure. I think berberine would be, I mean, I can't tell you to take it. I don't know, your background and everything, but I know that it is a good alternative to diabetic medications if you can, with weight loss and diet and everything. So it could be something you could transition to if you made those steps.
I heard at one point that there was a test, and I forget what it was called, and that was another $150 plus test. But if you were someone who was diabetic, it would actually tell you whether or not vitamin E would help you or hurt you. And if you know what
I'm sorry.
Go ahead.
Okay, so
I forget what it's called.
Got dumped in my lap, and it may not be what you're talking about, but this is just another genetic issue.
Haptoglobin. It's the haptoglobin test. So you get your haptoglobin test. And if you get this haptoglobin test and you're diabetic, it'll tell you whether or not you have a certain gene mutation that it will really help your diabetes to take vitamin E, or it'll really hurt you if you're eating a lot of foods with vitamin E or taking vitamin E.
I'm so glad you brought that up. Yeah.
What have you learned? You've heard something. Yeah.
Yes. So this just got dumped in my lap just the other day. So this hails from the GSTP1 gene, which is glutathione S-transferase pi1. Bunch of big names. So anyway,
a nutrition geek and genetics geek that it rolls off the tip of your tongue. I mean, it really does. It's just like, and it's so
yeah. Yeah,
that's
she's got a blah, blah.
That means
yeah. Oh yeah. I just laughed with my husband the other night. I said, who came up with all these names? The GSTP1 gene variant affects glutathione synthase. So glutathione is the master antioxidant in the body. Glutathione is super important. And if you're low, increased oxidative stress, cancers, all sorts of stuff. Anyway, funny enough, the GSTP1 gene does affect vitamin E supplementation, and it really depends on whether you have a heterozygous or homozygous status, whether you can tolerate vitamin E supplements. I just found that out actually, and I was taking about 200 IUs of vitamin E a day. I found that was too much. They suggest 75 IUs, which is a very low dose. That's for like children. If people have this gene, if they have a heterozygous version of it.
Very cool.
Can I ask one more question?
Of course, of course.
How do we, there's so many supplements on the market, and I try to research mine, go with really good companies. Can you give us any tips on how we can find these good companies? I don't want to take supplements that aren't doing anything for me.
Right. Yeah, no, absolutely. So great question. Yeah. Third-party testing, I don't mean to, be so generic. Third-party testing is huge, huge. And even then, like, they really got to have the background to back it up, because so there's some reputable brands such as Now. Have you heard of the Now brand? It's a very generic brand. It's all caps NOW. While they're considered third-party tested in a family-owned vitamin company, I just read an article from 2021 where they failed 12 different batch tests for curcumin and turmeric. So yeah, you just really want to do your research. I could recommend, so there's a couple really reputable brands that I work with. One is called Thorne, THORNE.
Okay.
Very reputable brand. I will tell you, a little pricier, but intermediately priced on my scale. So I'll tell you that one's intermediate. Another one would be called Seeking Health.
Speaking.
Seeking, SEEKING,
Okay.
Health.
Mhm.
That's by Dr. Ben Lynch. Dr. Ben Lynch is also a nutrigenomics counselor. He's got so much more behind him than I do, but really, really big supplements. Another one would be Pure Encapsulations. Now that one will be, I would rate that very pricey. You're going to pay $75 to $100 for, depending on what you're purchasing. The quality is there though, and they're actually one of the ones I would have recommended for curcumin, which is a derivative of turmeric powder.
Right.
So let me think. Jarrow is another one. Love them. JARROW. Very
Okay.
affordable. Very
Okay.
affordable.
I use Now. I use New Chapter. my resveratrol is from Luma Nutrition. So I don't know. But I will look, can you think of any others? I'm going to research them all. So
yeah. Those are the primary ones I work with. I do so I sometimes use Now. It depends. Sometimes I'll deal with NutriCost. That's NutriCost. I'm going to tell you though about NutriCost and Now. Actually, I'm going to add Nature Made in there, which you would think is a high quality supplement. No, you got to be careful with Nature Made, Now, and NutriCost, because sometimes they will use like soybean oils and sunflower oils and all of these PUFAs, polyunsaturated fats, oxidize very easily. They're not good, a lot of omega-6 fatty acids. So I look at the quality of the ingredients they're utilizing. Sometimes I have found now to use extra virgin olive oil as an ingredient, which is wonderful. So you really just want to look at the other ingredients in it. You don't want a lot of that bad oil.
Well, I have my homework for me, so I'll be doing some research.
Yeah, definitely. Those are some great brands to start with.
I try to take a good multivitamin to get as much as I can in one pill too. So, but but I'll
I'm
be
not
with
a fan of the multis, although it depends. They have a time and a place. You'll find Seeking Health has wonderful multivitamins. Dr. Ben Lynch, again, he is an MTHFR expert, geneticist. He formulates all of his multivitamins. He has methyl-free versions. He has methylated versions. He has histamine X, which is a supplement for histamine and the Dow gene. He's got it all. Go to Seeking Health. You will not be disappointed. Going back to the berberine discussion, so I have my mentor and my friend listening in. She wanted to add that diabetics, if you're taking metformin, you should not take berberine with metformin.
Thank
Just
you.
to add
Save me some money. Okay, good.
that. So I typically will break it down for them and say, okay, well, we're going to have to do everything separate. What you first do is you do baseline vitamin level testing. Before you even start the vitamins, test your levels. You need your levels tested. Then you can start your regimen. 3 months afterwards, you would retest to see if there's any improvement. But yeah, I typically for the first 3 months suggest people take everything separately in their multivitamin. And I know that sounds crazy, but I could boil it down to about $100, $125 for everything that you would find in the multivitamin that I could purchase separately.
And I'm looking at, I think someone just shared, and I think that might have been Nancy. I can't see all of her vitamins, and I feel terrible because we talked about Centrum that it just does not absorb in most. I mean, I've seen studies that it just does not absorb in the body. It's been kind of I mean, I was told it was a waste of money. Um, when you get the super B complexes and the B vitamins and such, you do need to make sure that they're bioavailable and methylated. Is that what I think that's what
Not
Stephanie said?
necessarily.
They don't need to be.
Well, no. So methylated is the preferred form. That is absolutely the preferred form. But
Yeah.
going back to, and I know it's so much to pack into a small amount of time, but the COMT mutation, huge determinant of whether you can take methylated vitamins efficiently. If you take them and you have a slow COMT, you would develop things such as joint pain, brain fog, anxiety is a big one, insomnia. So methylated vitamins are definitely not for everybody, although ideally what everybody should take.
Yeah.
Hi,
Steph,
Nancy.
I put the list of vitamins that I take every day that were prescribed 4 years ago by my general practitioner. They're in the chat.
Right. That's what we just we were talking about. I was talking about
I don't
yours.
think she actually saw them though. If you click on them, they'll go full screen.
The
Yes.
Centrum's 50, I'm concerned about actually doing anything.
So,
So yeah, I've looked them over. So as far as I'm not necessarily familiar. Let me see here. Let's look. So you get the B12. So
right on the
wow.
picture.
Oh right. Yeah. You're okay. So you have a methylfolate supplement here, but you
Yes,
also have
I have been tested over and over for vitamin deficiencies. I have vitamin D, B,
yes.
or folate.
Gotcha.
Sounds like
how do
she
you
has the
feel-
MTHFR.
Does she?
I know she probably hasn't been
Oh,
tested for that, I would
no.
imagine, but you don't think so?
So how do you feel when you take the methylfolate?
I've been taking it for years, no problem.
No problem.
And I
Okay.
also am very low in vitamin D. So when my pains first came on in my legs and feet 4 years ago, this is what they thought. Only one time did they actually give me a vitamin B injection in the office. But this is what they've recommended. I've taken it ever since with no problem. Prescription drugs, oh my God. I have had reaction after reaction after reaction. I won't take anything prescription anymore.
So One thing that you probably want to do, especially if you're considering, or you think that you're B deficient, or that would be to do the homocysteine test. It's super easy. Your primary care provider can order it, and it gives so much insight into how you're methylating and whether that folate's really making it to where it needs to go. The problem with excess folate in the blood is it increases homocysteine levels, and that increases the risk of cardiovascular events, adverse events happening.
Yep.
So that's something to really identify. I can't see the doses on your complex, so I wouldn't know. Your mag oxide is actually a lower it's a lower absorption magnesium. So I wouldn't recommend that. If you want a wonderful magnesium supplement, it's called Citramate. Citramate by Thorne, Thorne.
Right.
It's magnesium citrate malate combo. Oh, it's wonderful. That one is very neutral. I'm able to recommend that to everybody. The other one would be either magnesium glycinate or like a L-threonate. But if I were you, I would just try that Citramate. That's a wonderful magnesium to try.
Should I just
I just
continue
wonder,
with the others?
With your D3, you want to add a K2. I would say
K2M,
K2M
K7.
if you don't have the histamine issues. If you have histamine, it'd be K4. But you definitely, especially being having the peripheral artery disease, you want the K2. That's going to
I,
facilitate the calcium removal from your arteries to the bones.
they're
There's been
saying,
studies done.
they're saying it's not they're not saying, what are they saying? Oh, it's not neuropathy now. The doctor has called it PAD. You're right. I'm sorry.
It's
Yep.
okay. But, interestingly, though, if you do suffer from any neuropathy, a really great B vitamin for neuropathy is called benfotiamine. It's bioavailable B1, and it's typically taken like 300 to 600 milligrams a day. I take it. It cured the neuropathy, or at least it stopped the neuropathy in my toes that I was developing, where it was like a pinching pain. They doctors use it regularly for people. Also, I believe diabetes. You may want to check though.
But for the B, I know that, something that really, again, helped me is really making sure and stuff. And there are some that have the folate in them, so you can get a super complex methylated liposomal B vitamin that goes underneath your tongue that's also methylated folate as
So
well
so
with
to make
folate.
it, yeah, methyls. So you hear methylated vitamins and your brain
Yeah.
thinks methylated vitamins. There's only two methylated vitamins, B9 and B12, known as methylcobalamin and methylfolate. So if you can't have methylfolate or methylcobalamin, then just throw that out there, because there's no other methylated vitamins.
But I'm taking methylfolate.
Mhm. I would be careful, because you also must have a form of folate in the super B complex. I would be curious to see how much is in that.
Yeah.
Because again, like I said, too much folate without cofactors, you can raise your homocysteine.
And
Yeah.
that's, when you're talking about, you know, plaque that's going all the way down and 100% blockage is going down your legs, there's something damaging the arteries with that much calcium. And so it might be an issue to get under control if you can get to a functional medicine dietitian, someone who can get those blood tests urgently and get you on the right, right supplements, as is what happened with, my dad and even myself. My LDL particle number was so high. They're like, what is going on here? And they realized that as soon as I was able to get on the liposomal methylated B vitamins with folate, that my homocysteine levels dropped and my small LDL particle numbers really dropped significantly over the course of time. So something to take seriously and check into. And I had one I was going to say, so,
Oh,
it's stuff you got to it. The hair
Yeah, that's a
testing
wonderful
versus
question.
blood testing? That's a really good question.
So
Thank you,
that's where I
Kim.
was going with that metal toxicity I was talking about earlier. Is I thought to do an HTMA test, but that's an overview of the big picture. Like if you want to take a piece of that pie, that would be the blood testing, and that tells you what's happening right now. HTMA is a big picture of like the last 3 months to 9 months, I
Mhm.
guess, depending. So yeah.
And
Um,
also, um, fish oil, omega-3s. Some people can't take a general like fish oil and are concerned because of the thinning of the blood, and they're already on aspirin blood thinner. Their arms are just completely tattooed with their blood at the surface there. Um, I was told with the fish oil, I was getting it off the shelf, then I was getting it from general Amazon, whatever's the least expensive. I was told that most fish oil on a store shelf is rancid, has absolutely no impact whatsoever, could even be doing damage.
Oxidative with it. It also has as much as omega-3s, it also has omega-6, and that's PUFA, polyunsaturated fatty acids. Those are the ones that oxidize very easily, that cause oxidative stress in the body. Seed oils, that kind of thing, um, are in the same line with like the omega-6s. Omega-6 are the bad oils.
So so when it comes to fish oil, like I'm supposed to take it supposedly because I have a precursor to macular degeneration. So they told me I need a lot of omegas. I ended up with getting this one in a bag, and it's from a reputable company. They're very fresh. They make them all the time. They don't let things sit on store shelves. So even though it's through Amazon, it's not Amazon filled. It has to go through the actual little small manufacturer. What is your suggestion there for people with omega-3s? There's so many options. You even see the commercial on TV for krill oil. Is krill oil really better than a general fish oil, or how do you
Yeah,
feel?
so you're not gonna like my answer, which is dealing with my cardiologist, and I've actually had 2 opinions and hey, third time's the charm, so maybe someone else has some input, but, I had 2 cardiologists tell me that that's old news. Fish oil has not really been proven to help the heart any more than you would think, and that it's really just kind of a waste of money. I didn't want to believe it. I'm like, no way, you think fish, heart health, you know. And I looked it up. I found so many articles about it that sure enough, there is not it. I mean, if it did make any contribution, it was so nominal it wasn't worth mentioning. So I mean, unless you can find other studies, I personally stopped taking it, and I don't want to tell anybody else to do that unless that was me, but I don't use fish oil.
Yeah, and I don't
So
do it for heart health. I was doing it more that they said that
for
it would
the
help with the
eyes.
macular degeneration.
Yeah, that's one, I'm just a patient on. I don't deal with it with nutrigenomics, so I don't know, but
Interesting.
I stopped taking it. It is a PUFA too, and, PUFAs increase, oxidization, estrogen, and I already deal with estrogen dominance, and I notice when I take fish oil, my breasts ache. So there definitely is there's something happening. So it isn't for me. It's not something I recommend, but not to say that, I'm just not an expert there.
I love
Let's go into the
Go ahead. Sorry.
let's go into the H. pylori. I'm really curious about that, and I know one of our admins
So
is really interested
I
in that as
I
well.
actually am excited about this one because this is one that when you put it on the list, I thought, I don't know anything about that. That's not nearly my cup of tea, but I will tell you, in the last year and a half, it actually is. I've worked with quite a few people I who have H. pylori or SIBO. Um, so so the reference for H. pylori eradication is Bifidobacterium, Lactobacillus, and Florister combo. What that means, those are 3 different forms of a probiotic. Technically 2, because Florister is a yeast. It's not a probiotic, but they call it one. So anyway, what this means is, so there's Floristor. Floristor is a patented version of Saccharomyces boulardii. Saccharomyces boulardii is a really specific type of yeast that is complementary to a probiotic. So you would take Floristor with a probiotic. And it basically what it does is it takes up room in your intestines, so it basically pushes out all the bacteria. There's no room left for the
Interesting.
bacteria to grow. So the big thing with Floristor is that it's one of a kind. You'll see Saccharomyces boulardii available on Amazon, wherever. If it's not the brand Floristor, it's brewer's yeast. It is literally beer yeast. So they have a special form. Floristor has a patented form called CNCM-1745. And so that's what you would look for. So that's one component. Then you need bifidobacterium and lactobacillus combo. There's so many strains of each of those. There's Lactobacillus rhamnosus. That's an important one. I did the research for you guys, and the combo that I found that was really wonderful is Floristor, and it's Renew Life Women's Probiotic 25 billion CFUs, which is really important. It has 12 strains. And you would take that with the Floristor, and that really helps to eradicate H. pylori. In addition, if you're having like gastric distress, where you're having like a lot of acid reflux, or your stomach's burning, or if you just you have stomach burning issues, a fantastic trick is marshmallow root. Now this one I can't hail enough as being a godsend.
What?
Have you heard of marshmallow root?
No.
So you can buy it's in capsules. You can also prepare it as a tea. Let me tell you what. So I'm going to go back a little bit. I'm going to jump around a little bit, but so PPIs, proton pump inhibitors, are what they give people for like acid reflux, indigestion, all of that. PPIs are so destructive to the stomach biome, and also it depletes you of B vitamins. It's like B vitamin. It depletes you of vitamin C, calcium, magnesium, and folate, big time, and B12. So me having MTHFR, me treating others, I thought, well, you really got to look into these medications people are taking and how are they. Another one's metformin and methotrexate. Also, those really deplete folate in people. So anyway, the PPIs, I thought, well, what do I do? Because, I have a lot of clients who have stomach issues. Marshmallow root I use personally, and I was recommended for actually bladder pain, which I have from my venous compressions, long story. But so anyway, when you take it, and I can't stress this enough, and like I never used to be able to take aspirin. Aspirin would give me really bad heartburn. I can take a marshmallow root capsule, and within 45 minutes, you literally feel the whole inside of your body feel like a coat. It's like it coats it in a marshmallow mucilage. It's so natural. It's very effective. I don't even need the full dose, and it immediate. I mean, PPIs take days to build up in a person's system, where you won't notice the effects immediately, but marshmallow root works instantly. That's another one. And I looked into it. It definitely supports H. pylori eradication. Let's see here. It coats the entire digestive tract, urinary tract, and protects the lining from irritation and bacteria while healing during H. pylori. So it works, and it works instantly. I'm obsessed with it. I buy my brand on Amazon. It's called Nature's Way. It's like $7. And let me tell you, I have probably 12 bottles here. Like, I'm afraid I'll run out.
Can you
So I
tell us
like
what it is?
stockpile it.
What is it?
It's marshmallow root.
I know,
It's the
but
best.
not like the marshmallow we would put on a s'more, right?
No, it's
Oh,
a
yeah,
flower.
right.
It's a flowering, yeah. But I don't think it's the same thing. Marshmallow root and marshmallow. I'm over here Googling it myself. I'm not really
Yeah,
sure on that.
I thought marshmallows were like a man-made concoction, although like sugar and, I don't know what a marshmallow is.
Yeah. So Marshmallow candy is different. It does not contain the herb marshmallow root. So they are different. But I think maybe marshmallow root was named that for the, I don't know, the fluffiness of it, but it definitely, you can feel it like create a mucilage throughout your digestive tract. It's so crazy. So I really push that one. That one's wonderful. And it'll get you off of PPIs completely. Like you won't need antacids if you take this. And there's no downside to it. It doesn't interact with, oh, I take it back. The only interaction marshmallow root has is with lithium. It causes reduced excretion rate of lithium. So you have to be careful if you take a lithium medication.
Who would take a lithium medication? How would you even know?
Oh, that's prescribed by a doctor. So lithium is a mood control medication, and I mean that one's prescribed by a doctor. Then there's lithium orotate, which is actually a supplement you can get over the counter. It's like the more natural form of weaker form of lithium. But the patient would know if they were on lithium, I would assume. Let's see here. And then one thing I wanted to talk about was
Stephanie, can I ask you something?
yes, go
What
for it.
what is the dosage for that marshmallow root?
Oh, good question. And actually, let me grab it quick. Okay. So it's 960 milligrams per serving. I don't know if you can see this bottle. This is what it looks like. And if you find it on Amazon, it has 5-star reviews. This is just like it sells out. I have so many bottles here. I will never run out.
Okay, thank you.
Yeah, absolutely.
Is that once a day or
Oh, I'll tell you what, it says take 2 capsules as needed. I only end up needing 1, and I'll tell you, I don't even need it later in the afternoon. Now, if I went really crazy and I had a bunch of aspirin and then I went and ate some tacos and I'm asking for it, I might need to take it twice in a day, but I'm telling you, I'm so surprised at how quickly it works. It's really amazing stuff.
so it doesn't matter if you take it with or without food?
No, it doesn't matter for me. No.
Okay, good.
I would say though, because it coats your stomach in a mucilage, what I do is I take my medications, like my prescription medications prior if I can, because what it does do is, like I said, like with the lithium, it can kind of slow down the
Correct.
metabolism, because it's coating the inside of so that medicine's not being absorbed. So that's the only thing to really consider. But
So
it's
that would
pretty.
be really good for nighttime then.
Oh yeah. Oh man, I'm telling you. And you want to know something really crazy? So I was diagnosed previously with Barrett's esophagus, and I'm not sure if you guys know what that is, but it's precancer of the throat. I am not only in complete remission. There's nothing to even say that I have it anymore. And I really want to contribute that to the marshmallow root I've been using for the last couple of years. Absolutely.
Because I have GERD, and I was wondering
Oh,
if that would help heal, what's
yes.
going on with me.
Yes, yes, go buy a bottle like right now. You will thank me. I'm not kidding. And you'll throw out all of the Zantac and probably looks like you'll throw it all out as garbage. Hmm.
Yeah, I
Great.
wonder one of the things, and for people, and I'm curious on this call, Douglas and all of you guys, but my dad, when he was put on both the antiplatelet and anticoagulant therapies, he was told to take an antacid that is it starts with a P, and was told to take it because of the
Pantoprazole?
fear. What?
Pantoprazole?
That's it. And at first we didn't want to take it. We weren't going to take it. And because I don't like the side effects of it, and it becomes, they claim you can get off of it, but I just don't feel like you can. And because your system's never the same. And I'm wondering if they're concerned about him developing an ulcer and getting bleeding. And so I'm wondering if it sounds like the marshmallow root would do the same thing except without the side effects that
Correct.
this
So
has.
yeah, so when you have so when you take those PPIs, they basically just shut down the production of stomach acid and stuff, going on in your stomach. And in the meantime, they also block the absorption of the B vitamins and stuff. If you were to take
Yeah, that's what
pantoprazole
I'm
and
concerned about with my dad.
yeah, so this is why it's my bag of tea with nutrigenomics is it definitely impacts vitamin B absorption. And long term, they're just bad for you. You can really look the cancer risk goes up. There's so much. I'm telling you, like this marshmallow root, and I really, this is when I will stand by, I will stand on is that I was able to completely, I don't even think about Zantac. I don't even carry any of those things anymore. I don't need Tums. I'm very confident in that. And also I've developed in the past, like I've had ulcers and stuff. And that definitely that coats the ulcer and you don't feel that pain anymore and it helps it heal. Absolutely.
Sounds good.
Yeah.
Anyone else have any more questions for Steph? She's been here a while. I was trying to go back through and I keep, getting interrupted because I'm so interested in what you're saying, Steph, but I know that Douglas was posting a lot of questions and he said that everything's kind of been answered, but I just want to make sure that I'm going through and making sure everybody's questions, including his, are answered. Um, it's been so amazing. Can you guide us before we go in? We appreciate your time and your commitment to staying in our group, even though you found out you don't have PAD. We appreciate your support. We appreciate you, agreeing. I don't remember if I sent you the advisory agreement yet. But
I don't
if
think
I
so, but
didn't
no
send it.
worries.
Okay. But would love, for people to be able to tag you within reason, but would love for you to guide us on the types of things that you feel comfortable talking about, in answering and when they can tag you in the group and with what questions.
Yeah, absolutely. No, for sure. This is something I'm really passionate about. Like I said, with with nutrigenomics and stuff that really crosses paths with the cardiovascular. I mean, big time with the cardiovascular aspect. So I'm happy, to stay in the group and answer any questions anybody has for sure. Yeah.
And if anything, what I've loved is that you're so quick to research them too. Because you can make sense of some of the stuff out there and you can weed through some of the BS that we all read out there. Here's one quick one that is interesting that I don't know if you are familiar with, but we have one of our doctors that came on, Dr. James Antazana, who's in our group, and he is really
Mm.
big on Ceylon cinnamon. And there have been studies that have been done that talk about Ceylon cinnamon being able to lower the A1C, having an impact there, but also secondarily, but not as much proven that they're willing to step out and say it really helps, but also with cholesterol. And you need to do 2 or 3 weeks on, but then 2 weeks off. And you need to make sure you time this because it can build up in the liver. So it needs time to, you know, um,
Interesting.
to get out. But
I
that's something that we're all fascinated. And I know Marcia and I just started taking Ceylon cinnamon as well on a daily basis.
Yeah, so I've heard it just like you guys, I've seen it around. It's not something I use, it's not something I deal with at all, from a genetic standpoint. Um, the one that I wanted to just talk about real quick before we go that I mentioned before was the turmeric curcumin. Um,
Yeah.
that one that one's really great, but you've got to be really careful. You're better off purchasing it as a 95% curcumin with um, black pepper. And the black pepper has its own patent called biopepperine. Um, but curcumin would be that's the active ingredient in the turmeric. The reason you don't want to buy turmeric, and I'm like really want to stress this to people, turmeric is also a root. It's been found, and this was the one that failed for the Now brand testing was it's notoriously high in lead and cadmium. And like even places that have third party testing have, like I said, failed with turmeric. So I just avoid turmeric. The brand, I can't stress enough that I found it was a wonderful brand for curcumin. What I'm talking about is Pure Encapsulations. Wonderful brand, and they have 95% curcumin with the biopepperine. And so that I'm more familiar with than the Ceylon, but I think they kind of act the same.
Okay, so I use Me First Living turmeric curcumin with bioperine, 1,000 milligrams,
Biopepperine, yeah.
95% curcumin.
There you go. There you go.
One.
Hey, you're ahead of the curve. There you go. Yeah, so that's what you
have
want to,
one out of a dozen.
there you
Kim,
go. So yeah, that's
Ken,
what you want to look for, and ditch the turmeric in general. Like you want what you have. So
I'm excited. I have one right.
yeah. Can I talk about one last thing I just wanted to say that happened to me that I think is kind of really important to tell you guys, especially with the PAD? So I started taking Cholestoff like last year. I'm going through perimenopause, and I have a hypothyroid. When you have hypothyroid, your cholesterol will be totally crazy. And so my cholesterol shot up like overnight. I started taking Cholestoff, started taking all these plant sterols. And I thought, oh, this is going to be good. You know, I'm going to go back in a couple months, check it, and it'll be half. My cholesterol doubled in
Oh
like
no.
not even 6 months. And we were like, why? What's going on? I have, well, it's called a FADS1 and FADS2 mutation, which is a genetic thing that makes it very difficult to break down seed oils and things like linoleic acid, which peanut oil is really high in, meat, eggs, veggie oils, coffee. Well, anyway, what that's called when you develop atherosclerosis or you develop high cholesterol from plant sterols is called cytosterolemia. This has not gotten enough recognition, but it's something I also have. So I'm now going through genetic testing to confirm it. But yeah, that's something where you can't, the plant sterols work against you. They clog your arteries. They do have a process for treating it, which involves a medicine. It starts with an E. It's like Timbe or something, but I haven't made it that far yet. But I did cease taking the plant sterols in favor of pantethine, which pantethine won't act the same way. That's not a sterol. So, but something to watch for, especially if you're starting plant sterol supplementation.
Yeah, see, I mean, you're just driving home the facts that, I mean, what we've been talking about, and it's so challenging that it's really hard to tell. Genetics play such an important role, and there's still so much that we all need to learn. But if something doesn't feel right and the doctor says, you know, you should be taking this supplement or that medication, or there are even, you know, for example, with Plavix, in some people, Plavix really does not work. And you need to get a saliva test to actually, there is a genetic test that they do to make sure. And I tell people, well, before you do, if you don't think the Plavix is working, there's something going on, you're having repeat procedures and things are happening, ask them to get it tested. Everyone we've done that on, we've had literally more than a dozen people in our group who have been on Plavix and it just did not work for them. And it wasn't until we got involved and we said, hey, ask your doctor for the genetic test to see if your body is processing it properly. And in fact, they weren't there. It's really important to do the research. And you know what, if you can't do the genetic testing, well, there are so many other options out there. Even when she was saying, Steph was saying with the resveratrol, if you can't take that, she has a million other things. And it might be something, Steph, if you wanted to post in the group that these are some, you know, other options to resveratrol if you have the hyperthyroidism, that can also provide some of the same benefits, but to always ask your doctor.
Yeah.
You know, that might be really helpful.
Yeah, absolutely. I have an outline of everything we've talked about, and that's something I can submit to the group after I go through it. But yeah, absolutely.
And Kim, the test I forget what it's called, but you can ask them for a genetic test to see if the Plavix is working for you, if you have, I think it's an absorption issue or the way your body processes or something. There are also issues between Plavix and certain statins. And Dr. Anita Dua from Mass General, a vascular surgeon here, did a very early small study on how there are, I think, particular statins and Plavix that utilize the same vehicle inside the body. So the Plavix can't get on the bus if the statin's on the bus, and vice versa. Somehow, however that works. And I
With
would
the
imagine that's the same with other supplements and medications as well.
With the CYP pathways I discussed, those liver
With the liver,
pathways that
right?
metabolize everything, the test that people can get clinically that I'm not a big fan of because it doesn't give you that raw data, but it does give you valuable information. It's called gene site testing. That is actually a psychopharmacogenic test for like psychiatrists will give it to people who have depression or anxiety because of
Oh,
methylation issues. So what they do, they only
oh,
test two things, MTHFR and COMT. They test those two. Then they test all the CYP pathways. What they then do, and I don't have it with me, but I could show you another time. It's a whole report. They will literally take all the psychopharmacogenic medications and list how you metabolize them. They show your pathways. How are you an ultra rapid metabolizer, slow metabolizer, regular metabolizer? This does not just this is not just relate to psychopharmacogenic drugs, all medication. CYP pathways metabolize everything from hormones, medication, toxins, all of that. So gene site testing is actually, I mean, if someone really needed something on the sly, I would say that. And
would you mind
they,
putting that in the group too? Would you mind doing a post on that?
yeah, I can
Because
do
we're
chest
getting
testing
questions.
options and everything for sure. And GeneSight has a promise that if your insurance does not cover it, they will never charge you more than $330 out of pocket.
Still a lot.
My insurance,
Wow.
which is a lot, but
Yeah.
when I got the bill of what my insurance did cover, it was like $6,000. So, me paying
Okay.
330 in the big picture of things, but yeah, I'm absolutely happy to. That's why I wanted to talk and really connect was they're really, with genetic testing and stuff. Now that we have that, we don't have to put the cart before the horse anymore. You can go and look and say, hey, you should not be having folic acid, which down the line is going to end up giving you cardio. You're going to have a stroke. You're going to have a heart attack. You're going to have blood clots. You're able to be proactive in your own health, which is just so cool. So, I can't be excited enough about it. And I feel like it's really important for people with cardiovascular issues to know they have options.
Awesome. Well, thank you so much. We really appreciate you. We appreciate you taking all this time on a Saturday and spending it with us.